Well, as we end Black History Month, a highlight on the unique challenges faced by Black women and girls. Their prominent mental health and maternal health disparities, experts say they're rooted in societal roles and historical injustices. And tonight we're taking a look at the issue of maternal health with Dalianne Hemmings, Director of Maternal Health Equity at Hartford Hospital. Thank you for joining us. So let's first talk about the unique health challenges that these Black females face every time they go to the doctor. What do these challenges look like specifically?
You know what, there's many challenges. Part of what you have to consider is the fact that many women now know that they're at a higher risk of complications in pregnancy, those who are of color. And so you carry that. For some, they're carrying that in their pregnancy, right? They're carrying the stress of now this being something that they have to consider when they're trying to start their family. That in and of itself is not fair. It's definitely something that shows a disparity or a difference between them and their white counterparts. The fact that they have to consider they're going into a space, oftentimes a hospital, and many of the people who are caring for them may not look like them. And we know that there are nuances to having someone who care for you look like you and benefits to that.
And oftentimes, it is more difficult to find a Black female doctor, specifically if you do want one, correct?
It is challenging to find one. Not to say that there aren't ones that are there, but it can be challenging. And when you compare to the number of counterparts who are white that are in this space, there's definitely a disparity that we see there. We see that in providers, and we see that even with nurses, right? We know a large percentage of the nurses that care for many of the inner city community, they are not ones who are of color.
So the CDC says Black women are 3 times more likely to die than white people during pregnancy or up to a year after. So what can the medical community do to improve those outcomes? Because those statistics are just unacceptable.
You know what, that's a great question, because there's a number of things that at Hartford Hospital and throughout the system that we're doing. We are fortunate to have a maternal quality and safety team at Hartford, and we work really collaboratively to provide education, to help with patient navigation, to look at beyond just that 3rd trimester, right? And looking into what is being called the 4th trimester now, providing education early. We've recently actually put out what's called a birth wishes document, and this document is similar to a birth plan, but it makes it so that it helps with expectation setting, and people are able to look at it while they're still pregnant and go over it with their providers. This way, they can advocate for themselves. They can ask questions along with their support person.
And how can Black women be the best advocates for themselves at the doctor?
You know, a few things are important. One, knowing that you are your body's expert. As a person who is in your body, there is no one that knows it better than you do. Yes, as clinicians, we are trained. We do have a lot of education, and we are definitely there to support your birthing experience. But at the end of the day, if there is something that is wrong with your body, you are your body's expert. And knowing that, ask questions. Ask questions even if you do that a number of times, over and over, until you understand them. If you leave your provider office and there's something that you still didn't get, feel free to call back and continue to get the clarification that you need.
All right, all great information there. Thank you so much. This is Dalianne Hemmings, Director of Maternal Health Equity at Hartford Hospital. Thank you for your time.